Blue Cross and Blue Shield of Minnesota presents the Trusted Advisor Series. Today's session, the Blue Cross 2021 Medicare Product Portfolio. Hello, everyone. My name is Murray Buddy. I work in the Sales Education Department here at Blue Cross. I want to welcome you to today's session and let you know just how much we appreciate the fact that you've taken time away from this beautiful day and set that time aside to join us for today's session. And I also want to let you know how much we appreciate your business and the fact that you are our business partner. During the course of the call today, as we always do, we're going to keep those phone lines muted. So use the chat feature if you need to communicate with us with a question, a comment of any sort, and please feel free to do that. However, keep in mind that we may not be able to cover every chat or question that comes in through the course of our conversation this afternoon, but we will circle back with you after the call. Also keep in mind, folks, that the information we're sharing today is preliminary and it's not for public distribution. That's out of the way, so let's introduce our facilitation team. And Michelle, do you want to go ahead and say hello to the folks on the call today and introduce the folks who are helping you today?
Yeah, good afternoon. This is Michelle Forkenbrock, one of the individual sales leads, and I'm going to be doing the main presenting today. And then I believe Brad is online and going to say a few words here at the beginning. He is our sales manager leading our team on the individual and Medicare products. And Michael will be helping us with the chat questions, as well as our newest addition, Mark, has joined our team recently, and he'll be helping with the chats behind the scenes as well. So I don't know if Brad wants to say hello or, oh wait, maybe, I'm sorry, Brad was in a meeting today and had to jump off, so I apologize. But Michael, anything you want to add?
Yeah, good afternoon, everybody. My name is Michael Kearns, and part of the individual sales team. Like Michelle said, I'll just be helping with the chats today, so feel free to submit any questions that you think of. And just so you know, we'll try to keep the flow of the presentation going straight up until the end. So we probably won't be able to answer all questions during the presentation. We'll try to catch up at the end, but we want to get through the content. And then at the end, if we do have any left over, we'll be sure to follow up with you. And we'll also be trying to shoot you individual responses too. So the way we're going to kind of do it is, if it's relevant to the whole group, we'll try to answer it for the whole group. But just know that we will follow up with you, whether it's today or after the presentation. So feel free to submit anything that you can think of.
Thanks, Michael, and thanks, Michelle, and thanks, Mark, and Brad, and all the other folks who kind of helped us in the background, getting all the content together and pulling everything so that we were able to make this presentation to you today. What we're going to talk about today is how you are going to be able to describe that 2021 Blue Cross Medicare product portfolio, and how you're going to consider how your clients' needs are going to be addressed through that portfolio that you're going to learn about today. And you're going to summarize how we are positioned to win in 2021. So before we go any further, a couple of warnings that our legal department, our compliance folks like us to talk about. First and foremost, nothing that we're talking about today is for public distribution just yet. It's intended for you as a Blue Cross appointed agent and for your use only. So please do not distribute this content until you're allowed to do so after the October 1st start of AEP marketing. And also keep in mind that this information is preliminary, and everything that we're looking at, and most of what we're talking about today, is still pending regulatory approval. So there could be some fluctuations and some changes going forward. So we wanted to get this out in front of you as soon as we possibly could, with the understanding and your agreement that you're not going to share this with anyone else. And while we're at it, let me remind you that any rebroadcast, reproduction, or other use of the pictures and accounts of this game without the express written consent of Major League Baseball is prohibited. I've always wanted to say that. All right, so let's keep moving forward here and talk about some of the top 2021 highlights for MAPD Medical and Drug. So Michelle, take it away.
Yeah, so thank you again for joining us. We're just going to go over on the beginning of this webinar the key highlights that we're going to be talking about in more detail throughout this presentation. This first screen we're looking at pertains to the Medicare Advantage plans. So and again, a lot of this is based on agent feedback. So part of what we do as sales leads is we're talking with agents on a daily basis. After the AEP, we were taking notes and providing leadership with things we were hearing in the field. What did we do well? What were some of the improvements we needed to make on our products? So some of these enhancements that we're doing come from those conversations that we have with you in the field on a daily basis. We also have a consultant that we work with that kind of looks at how MAPD plans compare nationally. So between agent feedback and some of the national marketplace information, we've come up with some great changes I think you'll be happy with going into 2021. So some of those on the MAPD plans for next year, we heard on the primary care visit, why can't that be 0? So we were actually able to, core was currently at 20 with choice and complete at 5. We were able to get that primary care visit down. Maximum out of pockets was another common theme we heard, so those have been reduced. We are increasing the over-the-counter allowance, and there is a new Medicare acupuncture benefit we are going to be looking at in more detail, and then we have actually expanded on the Medicare acupuncture benefit for an additional offering there. And then one of the new adds this year to the Medicare Advantage plan for supplemental benefits will be a post-discharge meal program at $0 on all the MAPD plans, core, choice, and complete. As far as drug changes, we all often heard how confusing our 6-tier formulary was. And so we have reduced that, and we'll be looking now at a new 5-tier formulary, $0 preferred generics on all plans at preferred pharmacies, lowering the deductibles, not only reducing those max out of pockets on the medical, but also we got those deductibles on the RX portion of the MAPD lowered, another big agent request. So glad we were able to do that. And then another new Medicare program where carriers can opt into if they choose is a $0 insulin plan we'll be talking about, which will apply to the MAPD complete only.
And there's some highlights we wanted to address for the cost plans as well.
Yeah, just as exciting news in the cost market. We will be making some enhancements on the Platinum Blue cost plans. So want to go over those at a high level, and each of these we'll look at throughout this presentation as well. So we were able to do a set copay for primary care visits on the core. Similarly, we reduced the maximum out of pockets for a couple of the choice or for the cost plans. We were able to add some new supplemental benefits that we'll take a look at, including over the counter and probably the biggest request, getting dental on the cost plans. Expanded acupuncture benefit, similar to what we will be introducing on the MAPD. And then we already have the $0 diabetic supplies on our Medicare Advantage plans, but we will be carrying that forward, the $0 diabetic supplies through Essentia onto the cost plans in 2021 as well. And then similarly, we have the new 5-tier formulary and $0 preferred generics for all cost plans.
Great. And this is a roadmap that we thought that we would put together for our kind of more visual learners and folks who like to see things on paper in front of them as opposed to just hearing someone talk about it. This is what we call our readiness roadmap. These are all the different things that you can do to get yourself ready as a Blue Cross agent for open enrollment when it kicks off on October 15th, the marketing when it kicks off on October 1st, as well as the individual and family updates and key dates as well. And to grab that, go to agentcentral.bluecrossmn.com and click on the link and download a copy for yourself. We thought this would be just a nice way to kind of see how things are shaping up and how things are going, including, Michelle, I know that the Medicare certification has already kicked off.
Yeah, so we started Medicare certification, released it a little bit earlier than we have in years past. So that began on Monday, August 3rd. And in talking to sales oversight this morning, over 1,000 agents have already gone on and completed that Medicare certification. So while the deadline is September 30th, we want to make sure everybody is compliant and ready to be, being able to discuss the 2021 products with their clients once the annual enrollment opens on October 1. So September 30th is the deadline, but the earlier you can get in and get that done, the better. So that is live if you weren't aware of that. And then Myrnie, we've already started. This is our last live session for the 2021 Medicare portfolio today, but we've also started planning meetings for that second webinar coming up here, the putting it all together. So that's really going to focus on, we know this is going to be a different AEP. You're working with your clients, some virtually through, Zoom and other venues, some doing over the phone. While there is some face-to-face going on, you may have clients that are comfortable coming in, but those that aren't. So we are trying to, create that webinar with this unique fall in mind on tools that we may have that'll help through the online virtual enrollment process. So hopefully you can join us for those upcoming webinars, and then some exciting changes in individual market as well, with some new plan options that we're excited to share with you. So those will begin in September. So a lot around the corner.
Certainly is. It's a very busy time of year for us. And that first session of the putting it all together kicks off on Wednesday, September 9th at 9 a.m. and individual and family sessions kick off on Tuesday, September 15th. For more information, agentcentral.bluecrossmn.com. Look forward to having you register and join us for those sessions. Now let's turn our attention to the 2021 Medicare product overview, Michelle.
So this is a map that's just kind of showing going into 2021 what our entire portfolio across the state will look like. No major changes. So we're going to be moving forward with our Medicare Advantage plans with the 3 regional approach, where we will have 66 counties that you see there highlighted in the dark blue on the top over to the far left. Those 66 counties will have the Metro, West, and the South regional plans that we will go over individually here in a little bit. And one thing to point out here, just the Metro and West will continue to offer core choice and complete, as well as an MA only option, so same as this year. And we'll be utilizing the Medicare Advantage High Value Network, which is a statewide network. The South will continue to have core choice complete and then the MA only, but just note that that one does use a different network. So that one is the Medicare Southern Advantage Network. Cost plans, hopefully everybody's heard, but if you haven't yet, the good news that all 21 counties will remain open for business as usual for going into 2021 with the Platinum Blue plans, core choice and complete at a medical only or with prescription included. And those do utilize the Platinum Blue network. And then for the remainder of the state, regardless, which county you live in, the Medicare supplements are available in all counties, as well as the standalone Part D plans, which will remain at the Standard and Premier. One difference we do like to point out here is with the supplements. We get this question a lot: what is the difference between the basic and the senior gold? And it really is, the senior gold is a select supplement, which means it uses a designated network, which will be the Aware network, where the other Medicare plans are just any provider who accepts Medicare. So regardless of where you live, I think the one thing we're proud about, and hopefully you're excited about, being able to offer Blue Cross options, regardless of what county you live in, you're going to be able to offer them a comprehensive supplement plan, or the 66 counties that have a Medicare Advantage plan, if they want something lower cost with some extra benefits and cost sharing, those counties have those options, as well as, the 21 counties that have the cost plan. So regardless of where you live, hopefully there's a product that would meet all their needs.
Great. So let's turn our attentions to the specific products, beginning with the 2021 Medicare supplement, or those Medigap plans.
Yeah, so for this webinar, we're kind of going through the 2 Medicare supplements and Medicare Blue RX first. They're the least changes, so we'll just kind of look at most of this is staying the same. So supplements, like I mentioned, are available in all counties, regardless of where you live, but they may be subject to health history. So if somebody they can enroll at any time, but if they're outside their initial enrollment period, and they're wanting to apply for one of our supplements this fall, it's more than likely going to require a health history enrollment. But there are some guarantee issue situations. Probably 2 of the more common ones that we run into at the end of the year is if a plan is terminating in the marketplace. That could be a reason why somebody would be guarantee issue and not have to answer health questions. Or it's common that people, either retire or are leaving work at the end of the year. That's another common situation where if they're no longer eligible for their employer benefits, they could be GI. So there are some guarantee issue situations out there. If you have any members or clients that you want to, you're not sure about and want to reach out to your sales lead, we are happy to help you through those type of scenarios. But again, most of them are going to require health history unless there's underwriting.
All right, so let's look at some of the features of those plans.
Yeah, and a lot of, as the supplements, those plans they've been very popular in Minnesota for many years. So I think the supplements well. But you're probably going to be having these conversations with your clients as they start seeing Medicare Advantage plans advertised, or if they're in an area with cost plans. They're going to start asking those differences between why a supplement versus a Medicare Advantage plan. So this is nothing new, but just kind of a reminder that some people, key features with the supplement is they limit a beneficiary's cost sharing. Usually they're a higher premium, but as long as it's a Medicare eligible charge, Medicare pays primary, the supplement picks up the remainder, unless of course they're on, plan N has some co-payments, or the Medicare supplement with co-payments. The Medicare supplement with high deductible obviously has the deductible now. And post MACRA, we have to kind of remind people that the Part B deductible is not covered. They are responsible for that on the post MACRA supplements. But other than those costs, most costs on the supplement are covered. Supplements are also portable. So if anybody permanently changes their residency and moves to another state, they're able to keep their supplement plan. So if anybody's thinking of moving, they may find that a, kind of a valuable feature in being on a supplement. And one thing I want to note there, because I know not all the competition follows the same guidance. There are some out there that I've heard increase the premiums if somebody moves outside the area. Just wanted to reiterate that with Blue Cross and our supplement plans, they are portable. And if somebody leaves the state of Minnesota and moves somewhere else, they will still continue to pay the Minnesota premium. We do not have increases if they use that portability feature. And then guarantee renewable, during times of uncertainty, they might have health conditions. They just like knowing their plan benefits cannot change. There's, those that are a little, want something a little more stable and full coverage, like knowing that plan is guarantee renewable. The only thing that can change from year to year is the premium, and no limits on time travel. And this obviously, supplements do not include drug coverage, so they would need to pair that with a standalone Part D plan, such as Medicare Blue RX.
All right, let's get into some of the discussion of the premiums.
Yeah, so I'm not going to go through all these premiums individually. You can see the basic and the senior gold. They went up from $12 to $15, both pre-post MACRA. So we did see an increase there on the supplemental side. The supplement with co-payments, which is also Plan N, remained the same. And the supplement with high deductible, the old Plan F, actually went down a little bit. So kind of what we expected on the supplement premiums. But the one thing I want to point out on this slide, or I usually like to talk about, is our marketing materials. We are showing you the premiums for pre and post MACRA because we know you have supplemental books that include these pre-MACRA plans with a lot of clients. So we like to show you what that pre-MACRA rate is. Or you might be working with husband, wife, or one of them's already on Medicare, and then somebody's just now aging in where they are only able to enroll in post-MACRA. So just making sure you're comfortable with talking to your clients why those premiums might be different. Because when you look at the 2021 marketing materials, those are actually created for newly eligible members in mind. So they don't show the pre-MACRA rates. That it's going to be new materials show what were post MACRA only. So in the back of the summary of disclosure, there is a rate sheet that will show both the pre and post MACRA rates, but just know if you're working with like the sales brochures or the decision guide brochure, it is just going to show post MACRA. So we'll make sure you guys have the different rates, but just want to make sure you're comfortable with those conversations.
Okay, well, let's take a look at the Part D plans now.
Okay, so for Medicare Blue RX, unfortunately, we have a little bit more of an increase than we were hoping to have here. The standard plan did go up to $66.40. The Medicare Blue RX Premier had a increase up to 104.70. So we do acknowledge that this is a little bit higher of an increase than we wanted to see, but unfortunately, due to claims experience, cost of the medications, this is just where this plan has come in at. So we still think, for people, we know that there are lower cost plans out there in the marketplace, but those typically have slim formularies and very, restrictive on where they can pick up their medications. So it still will be beneficial to run the cost calculator for your clients, because even with this increase, if it's somebody that's taking medications and needs a more robust formulary, it still may be a good fit. I will acknowledge, we know that we're probably going to lose some members at this price point, but but it could still be a viable option. So. And then I'm not going to go through all these copays and coinsurances throughout this presentation where you kind of see the bold numbers or letters. That's where we're usually having some type of a change. So there was a slight difference on some of the copays and coinsurances, but overall, no major changes on the standalone Medicare Blue RX. It'll continue to be a 5-tier formulary. On the standard, tiers 1 and 2 will not be subject to the deductible, but tiers 3 through 5 will have the standard deductible, which for 2021 is going to be $445. And then over on the Premier, there is no deductible. We will continue to use the national network through the CVS platform that has over 66,000 pharmacies. Of these, 33,000 are preferred locations. So they can see these preferred locations, which would be Costco, Hy-Vee. You see them listed up there on the top. I won't read them all, but if they go to a preferred location, they have the lower cost sharing. They can still go to a standard pharmacy. One of the big ones is Walgreens. They can still go, but they're going to pay a little bit more. So no big changes on Medicare Blue RX.
And Michelle, I know that there's been some changes in the preferred pharmacies. Is that correct?
On the preferred pharmacies, well, on Medicare, are you talking about Costco and Cub?
Yes, I know that I recently saw something at Sam's Club has been moved from the preferred pharmacy list.
Oh, okay, I'm sorry. The other one, MAPD and Cost, has some new preferred pharmacies. Yeah, I just got notice the other day that Sam's is not going to be on the preferred pharmacy list any longer. But when I looked at the numbers, it's going to have a pretty low impact. We ran a member impact report, and it shows that not as many clients were using that. So yes, you are right, Myrnie. It came off.
All right, well, now let's turn our attention to some specifics regarding those Medicare Advantage plans for 2021.
Yeah, so for Medicare Advantage, switching gears here, two little housekeeping things to get out, and then we'll look at all the changes and the benefits and the premiums and things. But for those, as I mentioned earlier, we're still going to have the regional approach. So you'll see the Metro in blue, West in the orange, and the South in green. But one of the changes here is that Brown County, due to provider adequacy, we were able to move Brown into West. So now if you have clients that are in Brown County, they do not need to do anything. We will be notifying them that this move will happen automatically. So if they're on the core plan, they'll be moved to the core. If they're on the choice, they'll be moved to the choice. So we will be crosswalking them over to the same plan that they're on for the South, which I don't think is going to actually negatively impact any of these members. They'll be getting the same benefits, a richer Medicare Advantage high value network, so more options for them there in Brown County. So I think it'll be a welcome change for those members, but just wanted you to be aware of it.
And there's some changes regarding the Strive network as well.
Yeah, so with the Strive, we do want to point out we have fewer than 200 members in the Strive plan, and just cost of administration that we have decided to end the Strive. So it will no longer be offered in 2021. Because this is an HMO, we cannot per CMS guidance move a person from an HMO to a PPO. So these members will not be crosswalked. They will actually need to take action and fill out a new enrollment form. So we appreciate if you have, we know there's low attachment to agents on this drive plan. So hopefully this doesn't impact many of your members. If so, it's probably just a handful because most of these members that enrolled in Strive did so directly, but there are some that are attached to agents. So please, if you have any members, do not inform them until October 1. That is the guidelines 90 days in advance that we have to notify them by. So they will get their termination letter, and this will actually give them a guarantee issue situation to choose any Medicare Advantage plan in the marketplace. This would be one of those situations I had talked about with the supplements that is a guarantee issue situation where they could enroll into a supplement without health history. So they do have options. And again, it's not going to impact many members, but did want you to be aware of it.
All right, well, let's take a look at those. Got the housekeeping out of the way. Let's start taking a look at the specific MAPD plans beginning in the Metro.
Yeah, so some good news stories for the Metro Medicare Advantage plans. So we'll see here at the top, we are seeing premium reductions across the board in the Metro. So the core will remain at 0. The MAPD choice is going down some to $79.20. The Medicare Advantage Complete is going down to $157.20. And actually the MA only, which was currently at $35, will be going down to $14. So no changes to the counties here. They must reside in these 9 counties to enroll. But then they have the Medicare Advantage High Value Network. So even though they have to live in those 9 counties, this network is actually statewide and includes 96% of the providers in Minnesota. So we only have some of the key ones listed out here: Alina, Park Nicollet, Fairview, Mayo, North Memorial, but there's many others. So the one thing I do like to mention at this point is if you're out on the Find a Doctor tool, make sure you're looking at the Medicare Advantage High Value Network. It's confusing because we use the High Value Network on the small group commercial side, and they are actually having some changes right now where I think Alina and Children's are being added, but Park Nicollet's coming out. So they're actually having some changes. If you work in the small group market, you were probably already notified of that. But I've had quite a few agents panic thinking that that means those providers are coming out of the Medicare Advantage High Value Network. So just want to reiterate, when the changes you might be hearing about on the High Value Network on the commercial side do not impact the Medicare side. The Medicare Advantage is still very strong, 96%, and just make sure when you're doing the Find a Doctor, you're looking at the right one. And if you have any questions on that, don't hesitate to reach out to your sales lead.
Thanks, Michelle. Let's take a look at the West region.
Yeah, same on the West. Again, that Brown County moved over to the West, and other than that, it remains in 42 counties. Premium decreases in the West as well. So MAPD Core came in at 0. MAPD Choice West dropped a little bit to 84.20. Complete also saw a decrease to 83.10. And I'm not quite sure how this happened, but price-wise and claims experience, the MA Choice MA only actually went from 35 to 0. Same Medicare Advantage High Value Network, which is statewide, includes Fairview, Health Partners, Alina, Park Nicollet. We added Essentia and Sanford here just because we know in this area, those are 2 important providers. Mayo Clinics, and I did see a question come in. When I say Mayo in the Medicare Advantage High Value Network, this includes both the Mayo Hospital as well as the Mayo Clinics. So let us know if you have questions on that. But again, very robust statewide network and good changes here for the West.
All right, let's talk about the South region.
Okay, so with the South, we did see some premium increases in the South. So in a minute here, we're going to be going over some of the benefit changes I think you'll be pleased about and will help offset these increases. But simply due to the higher cost of care in the South, not as much competition. This is just where these premiums are coming in at. So the core, we were not able to keep that at 0, so it did go up to $38.40. The choice saw a pretty good hit going up to $119.50. The MAPD complete went up about $10, but when we are looking at the complete enhancements for all regions, we were really trying to make sure we enhanced the complete plan. So with that, we should be able to talk to that increase for the complete. And then the MAs only went from 35 to 14. So in these 15 counties are the Medicare Advantage Southern plans, or the MAPD South. And a little bit different, these members must not only reside in these 15 counties to enroll, they also need to stay within this Medicare Southern Advantage network. It is not a statewide network like the West and Metro. Now, when you look at just this, we have 95% of providers in this area. So when you look at that county area, it still includes 95% of providers within those counties. Now, if they are up in the metro or visiting a cabin up north, they do have urgent or emergency care coverage, and they can always utilize that doctor on demand if their medical benefit or their medical need falls within those categories. So just thinking outside the box, if they are still within Minnesota, but outside of those counties, don't forget about the emergency coverage and, like I said, the telehealth doctor on demand options.
And what would happen if someone in the South region were to be on vacation or spending a month in Arizona, for instance?
That's a great question, Marnie. So the networks that we talk about when we talk about the Medicare Advantage High Value Network and the Medicare Southern Advantage Network, those only apply when they're in Minnesota. So regardless of which plan they're on, Metro, West, or South, when they are outside of the service area and traveling to California, Kansas, Florida, then the travel benefit kicks in. So everybody has the same travel benefit for in-network benefits outside of Minnesota.
And I'll just take a look at the medical benefits that are kind of cover all the regions.
So yeah, again, this applies to all regions. So one of the big things we heard from agents, we needed to get the maximum out of pockets down. So on the choice plan, currently the Metro and West were at $3,900. The South was at $4,400 for in-network. So that will be going down on all regions to $3,100 in-network, and then the $5,150 out-of-network. And where you see that COM, that's combined. So our in and out of network maximum out of pockets are combined. So if they happen to have in-network benefits and being seen by in-network providers, but then they do go out of network, any costs they had already spent in network would apply to that out of network. So those are, or vice versa. And then on the complete plan, that was currently $3,200 in the West and Metro, and it was $3,400 in the South. That will be going down to $2,700 for all regions. The skilled nursing highlighted there, I'm only going to focus on the dark blue because those are the changes. The only change on that skilled nursing is the 184 is actually a Medicare number. So that's why that's highlighted there. No changes to the benefit other than that went to 184. The primary care visit, we were able to get to 0 across the board, which was a pretty good drop from 20 on the core plan. Then doctor on demand, we kind of called that out there right in the middle. This isn't really new, but with COVID and telehealth and some people not wanting to go into the offices or to a doctor setting, know that doctor on demand is an option. They do only see 3 different types of services, so they can do their primary care visit virtually through doctor on demand, or if their healthcare system offers a telehealth visit, that would still be 0. And then mental health and substance abuse can also be used through doctor on demand, and then just the applicable copay would apply. There are some decreases there you'll see in the outpatient surgery. I'm not going to read all of them, but outpatient surgery and then the outpatient other went down a little bit on all core, choice, and complete. The ER over there, we got, for some reason, it was $100 on the complete this year, which didn't make sense that it was more expensive on the more expensive plan. So we recognized that and filed complete also at $90 this year. Urgent care went down a little bit on the choice plan. Ambulatory surgical center, $100 on the choice and $75 on the complete. And then another big ask that we have from the agents, when we were looking at what improvements could we make, was the lab and diagnostic. So it will remain the 20% and the 15% on the core and choice, but we were able to enhance the complete plan to where lab, diagnostic, x-rays, those are now covered in full.
And now we talk about the supplemental benefits.
Yeah, and these are some of the supplemental benefits within the MAPD plan. So we had the over-the-counter was currently at $25. It will be going to $50 a quarter for core, choice, and complete. So we're hoping that with this increased amount, people will begin utilizing this. And we'll look at a slide in the back on the different ways that they can spend that money. But that did increase $25 a quarter on all plans. Acupuncture. So Medicare has introduced a new benefit where they will be covering 12 and then an additional 8 lower chronic back pain only. So there are some guidelines with the Medicare 20 visits that they have to meet certain requirements. And like I say, lower back pain, they can get those up to 20 a year, but then we are adding 20 additional visits for any type of pain. So whether it's one of the lower chronic back pain Medicare visits or another type of pain that they're using acupuncture to treat, it would just be the $20 copay per visit on core, choice, and complete. And then due to some agent feedback and national reviews of Medicare Advantage plans, post-discharge meals are one of those that we can add, and a lot of members that have this option find value in it. So we did add post-discharge meals to the Medicare Advantage plans, core, choice, and complete. They can get up to 2 meals a day for 28 days at 0 cost to them. And this is another one we have a slide on in the back dedicated just to this. So we'll go over that in more detail. Rechargeable batteries. If they are doing the Premier model, we do have to stay with True Hearing. But if they purchase that Premier model, it's now made where they can do a rechargeable battery and not have to deal with those expensive little batteries you're changing every 7 days. So that will come at 0 cost to them. And I think that's kind of it on supplemental benefits. Everything else still the same: e-visits, fitness, eyewear allowance, nurse line, everything else is remaining the same.
Let's take a look at the drug benefits that apply to all the MAPD products across the regions.
Yeah, so MAPD, so like I mentioned earlier, we are going to 5 tiers instead of 6 tiers. So with the tier 6, those were your adherence drugs or select drugs that they were your really inexpensive generics that we broke out separately that were just your cholesterol, high blood pressure, and diabetic pills. They are really inexpensive generics that we want people to take. So they were, but it was always confusing because they were low cost drugs, if not 0, but they were tier 6 and people just think tier 6 means the most expensive. So we did away with the tier 6 select care adherence drugs, and they are now more than likely just covered underneath the tier 1 preferred generics. So we simplified the tiering, and on the core, there will be no deductible for your tier 1 generics. And then tiers 2 through 5 will have the standard $445. Again, agent feedback, we heard that we needed to lower the deductible, so we were able to do that on the choice and complete. So currently, the choice had the standard $435 deductible on tiers 3 through 5. We will continue to have no deductible on tiers 1 and 2. And then instead of the standard $435 for tiers 3 through 5, it will drop to $300. And then on the complete plan, we have no deductible. So there will be no deductible on the complete. And another big change on the MAPD complete only is that we are adding a senior savers program for $0 insulin. So this is a new Medicare program. We have a slide on it in the back I'll talk about in more detail. But as long as it's on the formulary and they're going to an in-network pharmacy, they will have coverage for no deductible and $0 insulin. So this may be, an attractive option for those members that are dealing with the insulin. And then I'm not going to read all the code. Oh, sorry. I was going to say no major changes there. You can see them highlighted in blue. Probably just the biggest one is the $0 generics on tier 1 across the board. And as far as pharmacies, we don't have a slide on this, but it's kind of what I alluded to earlier. The pharmacy network is staying predominantly the same, except for Costco and Cub will now be preferred pharmacies. And then on the MAPD core, you'll notice that on the core plan, and most of you selling the core know that the core plan does not have preferred and standard pharmacies. It's just a smaller pharmacy list. We did increase those pharmacies on the core plan, and Walgreens is now in network on the core. So on the core, Walgreens will be in network. Now on the choice and complete, Walgreens is in network. It's a standard pharmacy, not a preferred. And then that same change we talked about earlier on Sam's is no longer going to be a preferred pharmacy.
All right. For those folks who like to see everything in one page is kind of a good summary of the benefit enhancements.
Yeah, so this is just kind of highlighting everything I already went over, so I won't read them all line by line, but just really enhancing that complete plan by getting the $0 lab, x-ray, and diagnostic on the complete down to 0, reducing maximum out-of-pockets, doubled the OTC. And I will read, so on the OTC one, I guess when we have the charts, we're just showing the MAPD plans. We don't have the MA only on those charts we just went through, so I should probably bring attention to the OTC doubled from 25 a quarter to 50 a quarter for the MAPD plans, but on the MA only, it actually quadrupled from 25 to 100. So that was an enhancement on the MA only that we haven't seen yet. We talked about the expanded acupuncture visit, the $0 hearing aid battery, the new meals, and then the other one to point out on MA only is we did increase the eyewear from 125 to 250. So a pretty big enhancement there on the MA only. And on the drug, 5 tiers, $0 preferred generic, lowered the deductibles, and again, that $0 insulin on the complete plan only.
Okay, before we jump into the cost plans, Michael, what are you seeing on the chats?
Yeah, so we have a couple of questions about network that I think we should address. And so one of them is Mother Mayo in the Mayo system network? And the answer is yes, that does include Mother Mayo. And it also includes, so we're talking about the Southern plan, it also includes the Mayo network. So it is a Mayo-centric network, including Mother Mayo, I guess is the best way to say that. And then we have another question, let's see. Mayo Hospital being St. Mary's or Rochester Methodist. It states statewide access with 95% of, yeah, so for that particular provider, I don't know off the top of my head, St. Mary's or Rochester. I don't know if you do, Michelle, but you can always check the provider search. So the provider search is just, if you go to the bluecrossmn.com and then click find a doctor, it'll ask you for what network you're looking for, and that is the easiest way to check any particular provider. So those were the salient questions that we had. We just had another one come in. Does a high value network in the Western region have Mayo and Rochester as part of the network? And yes, it does. So
Yeah,
feel free.
Yeah, so both the Metro and the West that utilize the Medicare Advantage high value network, which is statewide, does include Mayo, and that would be the hospital and the clinics.
So thank you for your questions, and we'll keep an eye on them too as we start to wrap up here.
Thanks, Michael. Michelle, let's take a look at the cost plans.
Yeah, so cost plans, 21 counties as they are today will remain open for 2021. So we will continue to have the core, choice, and complete. The core did go up $3 from 26 to 29, but the choice and complete remained at 94 and 164. And then the core, choice, and complete with the prescription drug included, they did see a little bit of an increase, but you'll see those new premiums there. Like I say, the business as usual. So those that are medical only, you know, they'll be able to continue to move between plan options like they have, you know, that's been a popular feature. But if they have the RX tied to them, then that would require a qualifying event. So if they are looking at going from a medical only to, you know, the cost with RX, that will be something they want to do potentially during the AEP. or they would want to do it during the AP. Otherwise, they'd have to have a qualifying event. But in this one, we'll use the Platinum Blue network. They have to live in these 21 counties, but the network is statewide, and it does include the Mayo Hospital and clinics as well. So no changes really to the Platinum Blue. And when I say no changes, you always have to go on and look, because there could be the small mental health chiropractor office, some minor ones, or, you know, smaller offices that can change from year to year. So I should say no major changes that we are aware of in the networks.
All right, then we get into the medical benefits as they pertain to those 2021 cost plans.
So yeah, so we were able to bring forward from, you know, feedback on the Medicare Advantage plans and implement quite a bit of it on the cost plans as well. So on the choice and complete, we were able to reduce the maximum out of pocket to $3,500 in network and $2,700 in network, or on the choice, and then $2,700 in network on the complete. Remember that cost plans, unlike Medicare Advantage plans, they do not have an out-of-network benefit. So that's why you only see the in-network max out-of-pockets reducing here. We were able to get that core primary care visit from 20% to a $20 copay. And same conversation we had on the doctor on demand. This isn't really new on here. They can use either their healthcare systems if they offer telehealth visits, or doctor on demand is now a Medicare assigned provider that can do virtual visits for things like pink eye. What are some of the other ones? Just a common cold. They can do prescriptions, you know, ear infections, things like that, that they could do simply over the phone or via a Skype Zoom visit. And then they also cover the mental health and substance abuse. So same as on the MAPD. And then down at the bottom, you'll see no changes on the other benefits. So that's why we're not going to go over those line by line. But we did add the diabetic test strips through Essentia. Those would be at full cost. So we get a lot of questions on that. Essentia is kind of like, if you go out to their website, that's like an umbrella, but there are lots of brands underneath Essentia. So as long as they are getting their prescription filled at an in-network preferred pharmacy, it will usually, you know, I mean, double check for sure, but that Essentia is a brand that they can pick up now on the cost plans at zero. Been very well received on the MAPD plan, so glad we're able to bring it over to cost.
All right, here are the supplemental benefits.
Yeah, so on the supplemental benefits for the complete plan, the eyewear allowance did go up to $150. We added the same option through True Hearing. If they buy the Premier model, they would get the rechargeable battery at zero. Excited to be able to add OTC. Currently, the cost plans do not have any over-the-counter benefit. So we're able to at least start on the cost plans for 2021 by having $25 a quarter on the core, choice, and complete. And probably one of the biggest requests we got, so excited we were able to add this, was the preventive dental is now going to be covered on the choice and complete at zero cost to the member. So we have a slide at the end where we'll look more at this dental benefit. But again, this is probably one of the big requests we were getting. So glad we were able to add that on 2021. And then acupuncture, this is the same Medicare covered. You know, Medicare has the 12 plus 8 visits for the lower chronic back pain. And then we added the additional 20 visits for any pain. And you can see their core would be at a 20% coinsurance per visit, $15 copay for choice, and covered in full on complete.
Great, and then we conclude our look at the cost plans by taking a look at those drug benefits.
Yeah, so the cost plans, both the cost plans and the Medicare Advantage plans use the Prime platform. So it'll be the same pharmacy network and the same formulary for cost and MAPD. So we did the same thing here where we obviously went from a 6-tier formulary to the 5-tier formulary. And we did, so on the core plan, the standard deductible is going to be $445 all tiers. On the choice, it will remain $0 deductible on tiers 1 and 2, but $445 for tiers 3 through 5. And then same as on the complete. So the change here as far as the $0 generics, that's going to apply across the board, core, choice, and complete if they go to a preferred pharmacy. So if they go to a preferred pharmacy, they'd be able to take advantage of that $0 copay. And I'm not going to read all these other ones. They minor changes to the copays or coinsurance right there that you see highlighted in the blue.
And as we did before, this is kind of that placemat view of the benefit enhancements for the 2021 cost products.
Yeah, so the core copay went down to 20, adding the $25 a quarter for the OTC, the diabetic supplies to Essentia. Again, the big one, preventive dental on the choice and complete, acupuncture, reducing the maximum out of pockets, 5-tier formulary, and then the $0 preferred generics on core, choice, and complete.
Okay, thanks, Michelle. Let's take a look at the 2021 supplemental and additional benefit details, beginning with dental.
Yeah, so these are kind of what we looked at. I just want to go over each of them in a little more detail. So on the 2021 dental, the cost plans added the preventive benefit to the choice and complete plans at no cost to the member. I do want to point out that, like I had mentioned on the one slide, cost plans do not have out-of-network coverage. So to take advantage of the dental on the cost plan, they do need to stay in the network for the dentist, and we'll take a look at that there at the bottom here in a minute. But for the MAPD plans, no changes to the preventive dental benefits. It'll still be the 2 oral exams, 2 routine cleanings, 1 x-ray, and 1 periodontal cleaning. The Medicare Advantage plans, because there is an out-of-network option, they can go in-network to get the best cost savings or zero. They can go to an out-of-network dentist, but they would be subject to balance billing if that dentist charges more than what our in-network allowance is. And just kind of want to put a plug on there, just like all other providers, dentists do have to either opt in or opt out of Medicare. So if it is a dental provider who has completely opted out of Medicare, we cannot actually pay on those claims. So make sure when you're saying you go out of network, you say out of network as long as the dentist hasn't opted out. And that is not very common. It hasn't come up a whole lot, but it has come up a few times. So we just want to put that disclaimer in there. And then one of the big things, especially with adding this to the cost plans, and they do need to stay in network. We heard, you know, the United Concordia Dental Network is small in certain areas. So we've really worked on expanding that. We have added an additional 600 dentists on the MA providers within Minnesota, an additional 10,000 nationally. These are actually being added as of 10/1/2020. So when you're meeting with your clients, a lot of times our find a doctor tools and formularies, and well, formularies will be out there, but some of the provider changes aren't shown on the website until it actually takes effect. But since this change is happening 10/1/2020, if you go out there at the beginning of the AEP, you will actually be able to look up you know, the dentists in your area to see who has potentially been added. So there will be 1,289 in Minnesota and 60,000 nationally. And obviously, since this is preventive dental only, we do get the question every once in a while, will it conflict if they purchase comprehensive dental? And by no means, it does not. So if they want to have more comprehensive benefits on dental, you know, there are some in the marketplace, and we have a standalone dental benefit as well.
Thanks, Michelle. Let's take a look at vision.
So yeah, vision, the $0 Medicare eye exams on complete for both the MAPD and the cost. And we had mentioned increase the eyewear allowance on the cost complete from $125 to $150. And probably one of the bigger changes, double the eyewear allowance on the MA only plans from $125 to $250.
And I'm hearing there's some changes in hearing as well.
Yeah, so in order to take advantage of the hearing aid benefit, they do have to work through the True Hearing vendor. They can do this at, you know, by contacting True Hearing to find out where the participating providers are at. They can work when the retail stores are open. Unfortunately, with COVID, we're closed right now, but there are kiosks available at the Blue Cross retail stores once we're back up and running. Hopefully not too much longer, but the $0 rechargeable battery, like I mentioned, that's only on the Premier hearing aid. And we have gotten the question, I don't think I mentioned this earlier, if they've purchased a hearing aid through True Hearing, like in the last 2 years, is this rechargeable battery something that they can take advantage of at $0 now? And unfortunately not. It's the way that the hearing aid is created, and the new Premier models are designed to have this rechargeable battery. The older models are not. So this is definitely something that is new Premier model going forward.
Okay, and you talked earlier about some changes in the over-the-counter coverage.
Yeah, so again, new to the cost plan, we were able to add that $25 a quarter allowance. The MAPD plans doubled from 25 to 50 a quarter, quadrupled on the MA only to 100. There are multiple ways that members can purchase this. So if you have any questions, please reach out to your sales lead. We can get you more information, but members will be given this credit. It either happens at the point of service. If they happen to go over that amount, they just pay the difference. But when they're at a select retail pharmacy or a retail store that offers this, they would pay, the discount would come off automatically. And then they can also go online and order if they feel more comfortable just calling and placing an order over the phone. You know, there's a catalog they can view and then call in the order. So there are multiple ways they can take advantage of this benefit to stock up on Band-Aids and cough syrup and cold medicines, different types of things.
All right, and you talked earlier about acupuncture. Here's a little more detail.
Yeah, so this is just kind of recapping that Medicare does cover 12 plus an additional 8, but that is for lower chronic back pain only. We will cover an additional 20 for any pain, so they could get up to 40 visits a year with acupuncture between the Medicare allowed benefits and our additional 20. There are providers, so they must use a Medicare provider. And obviously, if they're on the cost plan or Medicare Advantage plan, they want to make sure that their doctor is in our network. But there is special licensing that these acupuncturists have to go through. So double check on that to make sure they're in the network. And then some of these do require prior authorization, not all the time, but it could be required. And that happens on the back end. So the provider should know which visits are requiring prior auth and which ones don't. And then obviously the co-pays are up there at the top that we've already looked at.
And we're excited to be entering into our second year of our relationship with Silver Sneakers.
Yeah, so Silver Sneakers, we are continuing with Silver Sneakers this year, 16,000 locations nationwide. I think one of the biggest positives with Silver Sneakers that our members like is that they can go to multiple locations at one time. So if they are going to one gym for the swimming pool with a certain group of friends, but like to walk around the track with another person, you know, they can go to different locations as long as they're participating in Silver Sneakers, or if they're traveling, whether their snowbird's gone for a long time, or if they're just visiting family in another state for a couple of weeks, they can, you know, make sure these are nationwide fitness centers that participate. And then one thing we are working on expanding, again, with COVID and some people not feeling comfortable, some gyms might still be closed, or maybe the person doesn't feel comfortable going into a gym setting. We're really wanting to, you know, explore these on-demand videos, Zoom workouts, you know, things that people could still be doing at their homes to stay in shape. Or their fitness app where they're exercising independently.
Go ahead and talk about the insulin, Michelle.
Yeah, so the insulin, this is actually a new Medicare program. So Medicare approved a program called the Senior Savings Model. If you Google it, you'll see more information on it. But this is where certain pharmaceutical companies are participating with the carriers that opt into this program to be able to offer a $0 insulin on their plan. So we did choose to, so it's not mandatory, it's an opt-in program. So we are putting the $0 insulin program on our MAPD, the Medicare Advantage Complete only. So as long as they use an in-network pharmacy, it can be preferred or standard, they will have, and it's a drug that is on our formulary, this would be vials or pens, they would be covered in full. Now this does apply to Part D insulin only. And again, it needs to be on the formulary. If this is a Part B, I'm not sure how common it is that people still use pumps, but if they are using an insulin pump, that typically goes through the DME Part B benefit, and that would not be included. But any Part D insulin they're getting would be covered until they hit the catastrophic. So there's a reminder on the complete plan, there's no deductible. They wouldn't have any initial co-pays or anything. Once they hit the coverage gap, still covered in full. But if they happen to be taking quite a few medications or expensive medications and hit that catastrophic, at that point, the insulin, they would be responsible for their small copay or 5% on the insulin at the catastrophic phase. And if they go out of network to a pharmacy, then it would also be excluded. So just important, as long as they stay in network and it's on the formulary, it's a great benefit. We're excited to be able to offer this on the MAPD Complete.
Let's take a look at those post-discharge meals again.
Yeah, and post-discharge meals, this was one, again, this is on the Medicare Advantage only. Core Choice and Complete at $0 for the member. So when they they have a medically necessary inpatient hospital stay, or if they are discharged from a skilled nursing facility, qualified members will be contacted by a care coordinator who will help set up where do they want these meals delivered. Do they need gluten-free, peanut-free, allergies, things like that we need to keep in mind for special diet restrictions. So many options, they will make sure that they set that up and confirm where it's being delivered and when. These do come, kind of, you see the picture down there where it's pre-packed and frozen. They'll have expiration dates on there. So easy to set, nothing, they don't have to figure out who's going to provide this service in their area on their own. It'll all be coordinated and delivered directly to their home.
And sometimes it helps for us to kind of take a step back and remind ourselves, why Blue Cross?
Yeah, so thank you. Why Blue Cross? It's been a trusted brand for over 85 years. Hopefully, what we've gone through today, you would agree that we have a comprehensive product portfolio that gives both you as agents to share with your clients as well as members to choose from in your area. Just a broad portfolio with comprehensive supplements all the way up to Medicare Advantage or cost, depending on where you live, where they could choose from many different levels and have some cost sharing involved. But the good thing is they have choice. And we're a local company here in Minnesota. And again, always a big thank you to the agents, because you know that you are our largest channel where the majority of our Medicare membership is tied to your loyalty to Blue Cross and showing, keeping us in front of your clients. So we appreciate that relationship too.
And this is the sales team. And Michael, before we go any further, any final chats or anything that you wanted to address to the folks on the call?
I think we're good to go there. If you guys know how it works, a lot of times you'll think of things about 5 to 10 minutes after the presentation ends. Feel free to reach out to any of us here. It's kind of the point of this slide, to let you know that we're more than happy and available to help answer questions. Yeah, so our phone numbers are there. This is the whole team. So that's Michelle, who's presenting today. I'm second from the right there. Mark's on the team. And then our manager, Brad Larson, is on the left-hand side there. So we're happy to assist if you think of something that you couldn't think of just while we're presenting. And we're happy to help.
Excellent. And I want to extend my thanks to Brad, to Michelle, Michael, and Mark for everything you've done for the presentation today and everything else you've done to help get us to the point today where we've concluded our 4 sessions on the Medicare 2021 product portfolio. And there was a question that came through about, could you go back and show one of the slides? And great news, we're going to take the best of the 4 presentations and we're going to put that recording on Agent Central as well as the presentation of the slides. So the slides and the recording are going to go up on Agent Central, and I would guess that those will be there probably later today. So my final thank you to the team, my final thank you to you folks who attended today, and I wish all of you a great and happy, safe rest of the 2020, and happy selling, everyone. Take care. Bye now.